she has done?
Okay, so we're back in the vaccines at the clinic, and we are now where Dr. Michelle has all these really cool thermograms, and we're going to just pick one and walk us through, Dr. Michelle, of what somebody would look at with the thermogram, what you just explained to us, but now we get to see it live so they understand what these colors are.
Okay, I'm actually going to pick some that have before and afters because I think it's really cool that you can see how you can heal in a matter of time. So we have two breast pictures here, and these are both 3-month comparative studies, all right? Two different patients. This one is, we've got a little bit of inflammation going, especially around the areola or the nipple of the left breast. And then if we look at the 3-month study, we can see a great reduction in the amount of heat that was in the lateral sides of the chest wall as well as in the breast tissue. And if you look at the heat marker that's going around the areola on the left, it's less than it was in the initial scan. Okay? Then if you come down and look at this comparative study, again, we have a female that presents with incredible inflammation in her chest, a lot of fibrocystic tissue, and a 3-month study after treatment, we can see a huge reduction in the heat markers that are in the breast tissue, with more cold tissue presenting where it should be at the base of the breast. We have a little bit of an issue right here that needs to be resolved, but you can see that it's a lot less from where it began. Then if we look at this one below here, this is also a 3-month study with a 1 month in between, but this is a female that presented with systemic staph infection really over her whole body, but on her face it really presented that hot on both sides. And this isn't acne like a lot of people tell me it looks like, and I know it looks that way, but they were pustules that were subsurface that were not coming out. They were just living below the surface and then, coming out in different areas. So this is a 3-month study, and at the very end here is the 3 months, and you can see the reduction in heat from study to study. And the inflammation and the inflammation that was coinciding with the staph infection was actually receding.
Wow, that's really interesting. Have you, and I just want to ask this question because there's been a lot of, oh wait, what's your dog's name again?
Theo.
Theo. Theo's so cute. We just have to have him in here. Have you noticed, by any chance, people who carry cell phones in their pocket or cell phones on the ear that they are having these heat spots on their body?
Yes, and it's funny that you should mention that because I just had a patient who had a thermogram read, and she had on one side of her head a shape that looked like a cell phone had been planted on the side of her head, and on the other side it was not as hot. And we questioned that. We never did get an answer whether the patient had been holding a cell phone to her ear before she took the scan. But it does cause one to kind of ponder, because that type of radio transmission is going to create heat in the body.
So in your professional opinion, do you think that people should carry cell phones on their body or keep it on their body for long periods of time?
No.
And there you have it, folks. That's the truth. All right, great. So other than cell phones, are you seeing anything else like computers or other things that may be causing problems in people that are external like that?
Just more of the same. So, cell phones, things of that nature. I don't know what else there would be that would have a radio signature like that other than a cell phone.
Yeah, computers, I know a lot of times people keep it on their lap will have issues,
oh, yeah, that's
so
true. I didn't even think about that.
Yeah, I just was curious if you had seen that. So, all right, well, this is very cool, guys. This is real, and I would encourage you guys to come down and get your thermogram done by Dr. Michelle. Dr. Ray would also take care of you. This is real, folks. This works. You just come on down. This is Dr. Judy. Talk to you soon. Bye-bye.